My name is Dr. Michael Corey, and I'm Clinic Director here at Wellness Stop Chronic Healthcare Center in Tustin, California. Today we're going to provide you with new solutions to your thyroid problems. Now, you may have been suffering for a year, 5 years, 10 years, 20 or 30 or 40 years. But what I want you to understand is that there is a solution naturally without the use of drugs or surgery which can help your thyroid to heal. Now, your thyroid is very, very important in your body because it actually regulates every muscle, cell, and tissue in your body. Every cell in your body has to communicate through your thyroid to regulate its metabolism. So one of the quotes that I like to start my talks with is by Virgil, and it says, "The greatest wealth is health." Well, we all know that we've seen celebrities, people with great amounts of money and surplus to have a chronic condition, and they've succumbed to it. Well, traditional medicine, unfortunately, is using a 50-year-old model for thyroid care. That's right, 50 years of abnormal functional care through the use of drugs and surgery. So without further ado, what I want to do is I want to get started, and we're going to just educate you a little bit about how the thyroid works, and we're going to provide you with an opportunity to get to the root cause of your problem so that we can help you get back to 100% of yourself. Now, first thing I want you to understand is that all chronic health conditions have some things in common. Things that they have in common is oxygen deficiency, neurological misfiring, metabolic imbalance. Now, these conditions include your thyroid conditions, insulin resistance, your vertigo, your sciatica, chronic pain syndromes, rheumatoid arthritis, chronic neck and back pain, irritable bowel symptoms, depression, anxiety, and the list goes on. So what I would like you to understand is when we talk about your thyroid today, we're going to talk about functions, because that thyroid that you're actually having problems with supports your bone metabolism, your immune system, your brain and nervous system function, endocrine system, gastrointestinal function. So if you're getting irritable bowel symptoms, you have to look to the thyroid. It could be the core cause of why you're having the problem. Liver and gallbladder problems, growth in sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels, and most importantly, your proper stomach acids. If you are not metabolizing your food properly and it's not going through the digestive system properly, you're not getting nutrients into the bloodstream, you're not going to get well. So it all starts when we look at how things are working functionally. Now, medicine is great for emergency care. #1 in the world, but when we look at chronic health conditions, they just don't know what they're doing because they're treating you from a symptomatic standpoint. There's always another drug that they're going to try. But when did they go back and did they check you? Let me give you an analogy. If you have a wilting plant, for example, on your patio, is the first thing you think of is what drug do I need to give that plant? No, we're going to give it some nutrients. We're going to give it some sunshine. Maybe we'll change the soil. Well, that's exactly what we're going to approach your thyroid with, is we're going to look at a foundational basis of what brings health to your body. So the thyroid gland, we have a little breakdown that we want to talk to you. Every cell in your body has thyroid receptors. When these receptors attack the thyroid hormone, they bring these thyroid hormones back into the cell. So what we want to look at is we want to look at overall functions. So the key to your thyroid health is to get just enough of these hormones inside of your cells. Now, if there's not enough of these thyroid hormones to get into the cells, then we can get symptoms such as hypothyroidism, like fatigue. We can have problems with weight gain, depression, constipation, overly sensitive to cold and heat, muscle cramps, even when you're in rest. So when you're laying in bed, we can have problems as far as those muscles getting the proper information from your nervous system to relax when you should be relaxed, not go into contraction. Now, other things that we can look at is poor circulation, itchy, dry skin, stomach pain, gas, bloating, dry, brittle hair. Maybe your hair's falling out. Have you lost the outer third of your eyebrows? Well, it's likely your thyroid's involved if that's true. Edema, especially in the face. You'll get puffiness in the face, and brain fog. So if you feel like you're out of order because you're not able to think clearly, you can't grasp your words, you're not really sure, and you kind of feel like you're walking around in a fog all day, the thyroid could be the core cause of why you're having a problem. Now, if you have too much thyroid hormones, then you can get symptoms of hyperthyroidism. Hyperthyroidism can include heart palpitations, inward trembling, inability to regulate you're always cold, your hands and feet are always cold. You get night sweats, insomnia, difficulty gaining weight. Now hypo, you're going to have difficulty losing weight, but hyper, you have difficulty gaining weight. Now with Hashimoto's thyroiditis, you can have symptoms of both hyperthyroidism and also hypothyroidism. And remember, this is very, very common, and it's not medically diagnosed properly. To understand thyroid problems, we need to understand, first of all, we need to look at the thyroid gland. And that thyroid gland has to interact with your body. Once again, that thyroid gland has to interact with every single cell of your body, and it has crosstalk. So it's always communicating with your immune system, with your gut function, with your brain, and with your endocrine system. And each of these affect the others. So all of these will affect one another in one way or another. Your immune system can show dysfunction and communicate with the gut, which can communicate with the brain, which communicates with the endocrine system to regulate your hormones. So this is how it all works. Your hypothalamus releases thyroid-releasing hormone down to the pituitary gland. Pituitary gland releases luteinizing hormone to the reproductive system, and acetylcholine down to the adrenal glands. There's thyroid-stimulating hormone is released from a pituitary gland down to the thyroid gland, where it's going to secrete two types of hormones. An active form, which is your T4, you get 93% of that, and T3, which is 7% it's released. So the T3 is not T3 is the only one that's active, and you only have 7% of that. The inactive form, T4, you get 93% of that. So that inactive form has to be converted over to the active form to actually get into the cells. Now, you can think about this like a little boat ride or a little taxi cab, because this thing called the thyroid binding globulin is going to then shuttle that active form of T4 to the liver, to the gut, and to other tissues. So as it's bringing the T4 to the other tissues, the gut, your liver, and also to other tissues, it's going to carry that inactive form and it's going to get converted. 60% in the liver, 20% in the gut, and 20% to other tissues. Now that T3, which is an active form now because it's been converted in those different locations, is going to then be able to actually get into the cell receptor site, and it's going to get into the cell itself so that it can help you to regulate metabolism of those organs and tissues. So just a brief summary. Hypothalamus comes back down and it secretes thyroid-releasing hormone. Thyroid-releasing hormone sends signals down to the pituitary gland. That's going to secrete thyroid-stimulating hormone. After thyroid-stimulating hormone comes down, it goes to the thyroid gland, and we're going to get thyroid peroxidase, and we get 7% of that. That attaches iodine to it, and we're going to get our T4, 93%, and we're going to get our T3, which are going to get 7%. So what we want to look at is that thyroid's got to communicate, and it's got to come back down and communicate with that liver. So the thyroid binding globulin has T3 and T4, goes to the liver. After it goes to the liver, it's going to come back down in here. Remember T3 and T4, but T4 is inactive. The T4 is going to come down in the liver. It's going to get converted over to T3, the active form. As that T3 travels through the bloodstream, now it's freed up. It goes from the bloodstream into the cell. This is a thyroid receptor, so it's making contact. It's able to communicate, and we're able to get the functional aspects of the thyroid to work properly. That conversion is vital. The ability for each of these areas, the hypothalamus, releasing the hormone of thyroid-releasing hormone to the pituitary gland, to TSH down to the thyroid gland, releasing T4, 93%, T3, 7%, carried by thyroid binding globulin, and that thyroid binding globulin is going to carry that T4 into the gut, the liver, and to other tissues, and we get a T3, the active form which your body can actually use, which is then free to get into their cell receptor sites. So what I want you to understand is, and I know I've repeated this 3 times because it's so important for you to understand, that there's a process. There's 6 different patterns of thyroid dysfunction. And what we want to understand is that each one of these is vital for you to function properly, for you to exhibit 100% of your vital capacity. Blood tests are key in our program because success or failure is dependent upon proper testing. We have proper testing because the grossest mismanagement of hypothyroidism begins and ends with blood test. And that's a quote from a gentleman, he's a researcher, he's written a book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? Dr. Dadis Karazian. Studied directly with Dr. Karazian in many of his seminars, and incredible information, and it's going to help us get to the root cause of why you're having these problems. So if you've been told that your lab tests are normal, but you're still having symptoms, your doc says, well, let's just wait and see. We'll see how you do over the next period of time, but no changes have been made other than maybe they're spiking up your medication or bringing the medication levels down. Maybe it's like a teeter-totter. Every 6 months you're changing the dosage. Well, let's get to the core cause. Our typical lab ranges are not reliable. That's right, they're not reliable because that's actually a culmination of everybody that's had their lab tests done in the past year in that lab. It's an average. And who goes to the lab to get their blood tested? Usually sick people. So you're comparing yourself to a sick population, first of all. Let's look at the ranges now. Ranges can vary from lab to lab. So if you get your blood tested in Los Angeles versus San Diego, and different labs are actually doing that, you're going to get 2 different values. Might be up a couple points or down a couple points, but it's averages of those labs. Now, they use a bell-shaped curve based on the unhealthy people in there. So we'll see a bell-shaped curve. Remember when we're back in elementary and junior high school, we have a bell-shaped curve. And as that bell-shaped curve comes up, we're going to see it come back down. So we've got the extreme highs and we've got the extreme lows on each end. Now, our normal is based on these lab ranges. These are traditional lab ranges here. So in Los Angeles, we're going to get one range. In Chicago, we're going to get another range. Functional lab values are more sensitive. They're based on healthy function, and so they can reveal problems before you actually have a symptom presented. So how are your lab tests normal, but you still feel sick? Well, typical lab ranges are everything within this considered normal level. When we look at the abnormal lows and we look at the abnormal highs over here, we're going to see these are the disease diagnosis ranges. But when we look at a healthy range, you're going to see this middle part is highlighted and it says functional lab value. That functional lab value is where healthy people are. Remember that bell-shaped curve we talked about? Well, we want that peak. We want right at the very, very top where the healthiest people are. So these are the areas of lab findings that most medical doctors would consider normal from here to here. When we look at the functionality, you can still be sick and have problems because you're comparing yourself to a sick population. So what this really means is that these are actually very, very inaccurate, these traditional lab ranges that you're seeing on your blood test. What we need to do is we need to use functional lab values so that we can get to the root cause and bring those numbers in. And that way that we can compare you with a healthy population, not a sick population. So this is a functional range. Now let's look at some examples of this, because if we look at glucose, for example, test result might say that you have 73. Traditional lab ranges are 65 to 110. The normal range is, within this normal range is, they say 65 to 110. Well, the functional range is 85 to 100. So with that lab test range that you might have gotten back that says 73, they're going to say that you're normal, when in actuality you have hypoglycemia, decreased blood sugar, with a functional range. So how are we going to treat it differently? Much differently, because we're going to support the functions that will help bring that glucose back into normal ranges for you. Let's look at thyroid-stimulating hormones, since we're talking about thyroid today. If you have a lab value of 4.2, traditional values are from 0.3 to 5.5. If you have 4.2, they say that you're normal. But when we look at a functional range, your functional range for your TSH, or thyroid-stimulating hormone, is actually 1.8 to 3. So that 4.2 reading that your doctor considered normal is going to actually identify that you actually have hypothyroidism. So these go on with each and every one of your lab tests, and it's very, very important we start comparing ourselves. Instead of comparing ourselves to a sick population, compare ourselves to a healthy one. Here's triglycerides, hemoglobin. It goes on and on. So we do use these functional lab values. Now, typical thyroid test ordered is, and even with the Mayo Clinic, is thyroid-stimulating hormone and maybe T4. So they might check those two parameters to see how your thyroid's doing. And of course, if your TSH is up or down, they're going to regulate and give you either more medication or less medication. I like to talk about that as a Betty Crocker approach towards medicating our patients, because it's just, we'll give you a new recipe. We'll see if this one works. Well, your doctor prescribes a simple blood test that provides minimal information and give you minimal results. The only way that we can correct this is by making sure that we provide you with the proper testing so we get the most information so that we can get you well. So your doctor prescribes a simple blood test that provides minimal information for your insurance, and your insurance will cover that. Then the minimal test results, you get minimal treatment, which may be minimal cost at the time, but you pay for it in the long run. How long have you been suffering is my next question for you. Now, is your health care dependent upon your insurance making you sick? If they approve or they disapprove things? So they're not going to run expanded thyroid tests because they have a cheap way of managing you as a patient. It's a cheap way, and you're getting ripped off in your health and your vitality and the quality of life that you're living because you're taking pharmaceuticals that are a 50-year-old model. Now, conventional medicine is geared towards symptomatic relief and a cure with drugs or surgery after diseases have presented themselves. Functional medicine, which is what we provide in our office through neurological and metabolic approaches, this is geared towards wellness and prevention with nutrition and natural support before diseases progress into a disease state. So it's like black and white. And you have to make a choice of what your internal beliefs are, how what kind of results you've actually gotten from your care that you've been provided up to this point, and whether or not you're still suffering. So the decision is always up to you. But treating the thyroid gland with hormone replacement therapy is a 50-year-old medical model, as I mentioned. Sometimes it works, but too often it's only a short honeymoon of symptomatic relief. Then you have to go back and change that medication dosage again. Excess synthetic hormones flood the bloodstream with unnatural amounts, which can in turn cause receptor sites to become less active. So remember that T3 had to get into the receptor site? Well, that receptor site can get less and less active over time. And this causes your gland to slow down and eventually stop producing. It causes poor liver function and breakdown of elimination of hormones. And most synthetic hormones do not show up on blood tests. So hormone replacement therapy only keeps the TSH in a normal range. It assumes the thyroid is the only problem, which most of the time it is not the case, and therefore this treatment is not correcting the cause of the problem, and your condition and symptoms are not going to get better. So after years of this treatment, why are you still not better? You've been taking these hormones, you've been following your doctor's recommendations, but if you keep asking, your doctor, he's going to say, well, let's wait and see. We'll run another blood test. Maybe it's not all in your head, like maybe you've been recommended to a psychologist or a psychiatrist. Maybe it's because you're lazy, your doctor might say, get up and exercise. Well, exercise is important, but it's not the root cure for this. Maybe you just need to exercise more, do a little bit different. Maybe you really need psychiatric evaluation or psychotic medications. Or maybe, just maybe, someone has dropped the ball and you're not doing the necessary tests to get you well. Well, we're going to leave no stone unturned to help get you the proper testing so that we can help properly get you the care that you need so that you can overcome your thyroid dysfunction. And this is a big reason why you're still sick, is because you keep going around this merry-go-round, around and around. And you keep taking the medications, but you're not changing lifestyle, you're not changing diet, you haven't changed your internal environment so that your body can get healthy and heal again. Now, in 1998, the Journal of Metabolic and Endocrine Disorders stated that 90% of hypothyroidism is caused by an autoimmune thyroid. Now, this Journal of Metabolic and Endocrine Disorders is a Bible for endocrine function for medical doctors. They have all this information, but they're not doing anything about it because they're stuck in the box of medication, drugs, and surgery. So, what kind of reflection do you want to promote in the years ahead? Do you want to see the same thing that you did 5 years ago? Or do you want to start a new day and see clearly and have a new vision of health and your well-being? So what makes our office different is my next slide that I want to talk to you about. In all cases, we treat our chronic care patients with neurological care and we treat them metabolically. So that starts with the proper testing. So metabolic and neurological testing and evaluations are of detriment to getting you well. We have to make sure that we get you well through the identification of the core causes of your problems. A complete thyroid functional test is TSH and T4. Remember, those are the two your medical doctors probably run on your lab tests. We also have to run free thyroxine index, FTI, free T4, free T3, reverse T3, resin T3 uptake, thyroid binding globulin, and thyroid-stimulating antibodies. So we want to identify what's going on, thyroid peroxidase, thyroid binding globulin, antibodies, to identify either Graves' disease or Hashimoto's thyroiditis. Hashimoto's disease, hyper or hypothyroidism, and Graves' disease, which is hyperthyroid, these are not thyroid problems. These are immune system problems where your immune system is actually attacking your body's tissues because it's dysregulated. These are immune problems. There's an imbalance in your immune system that needs to be addressed. So once again, proper testing is vital for us to get to the root cause of the problem. So why would your immune system do this? Well, it has dysregulation. So your digestive system's not working properly. The immune system, 80% of your immune system is built through your gut. So when your immune system is imbalanced because of dysglycemia, which is your blood sugar, or exhausted adrenal glands, which are your stress glands, secrete cortisol, hormone imbalances, neurological imbalances, and proper testing can identify where in the realm of your health the problem is occurring. Now, why would your immune system react abnormally? Well, usually there's an active antigen that we see with our patients. Immune system is imbalanced due to inflammation. We can have chronic infection with bacteria, virus, mold, yeast, parasites. We can have parasites in the gut, the food sensitivities such as gluten. Now, we have huge amounts of media covering gluten nowadays. And please, please look at the research because its preponderance of evidence is revealed with our current research model. Now, we want to look at people functionally. Well, what about the fuel and activation that regulates your body? Every time you eat that gluten or gluten molecules and you're causing more inflammation in your gut, why do you think your body's starting to dysregulate? We've got to change that diet. We've got to get you on the proper diet for you. And that's what we'll do in our office. We can also have environmental toxins. We can have undigested food due to leaky gut. Maybe the villi in your digestive tract is allowing that bacteria virus to get into the bloodstream and go throughout the body. So we need to make sure we identify any of these problems that are taking place. So the internal area of your lining of your gut, and if we get that bacteria coming back in there, then it gets in the bloodstream. It causes more inflammation. Inflammation of your brain, inflammation of your tissues. Hormones are not going to be regulated properly. Heavy metals in your teeth. The silver fillings in your teeth can cause huge problems with heavy metals leaching into your bloodstream. Once again, proper testing is the answer. So Hashimoto's is the #1 cause of thyroid dysfunction, not something wrong with the thyroid. Hashimoto's thyroiditis. 90% of patients who have been diagnosed with hypothyroidism actually have an autoimmune condition causing the problems. Now, there's 6 major thyroid patterns that we need to look at. A true dysfunction is primary hypothyroidism. This is the only one in which your doctor can actually take care of. And so the pituitary gland tries to kick it in the pants by pumping extra TSH out. So the pituitary gland is secreting the thyroid-stimulating hormone. The only pattern of hypothyroidism that can be managed with hormone replacement therapy, unless it is also an autoimmune condition. So we have to check you for autoimmunity. Blood test, if you're high on the TSH, conventional medicine is going to give you a hormone replacement therapy. Typically, standard treatment doesn't screen for Hashimoto's because it doesn't change the treatment. They're going to still continue to give you the hormone, but they're not checking you from a proper blood test to check and see if you have Hashimoto's or not. Functional medicine, we're going to provide you with nutritional support for the thyroid, rule out autoimmunity by doing proper testing, and detect any problems that you have regarding your immune system before too much damage occurs within the thyroid. The next one that we want to look at, remember we got these patterns of thyroid dysfunction. Hypothyroidism secondary to pituitary hypofunction. Now in this case, the pituitary gland is fatigued and TS production is low. So we're not getting as much TSH down to the thyroid. This can be caused by chronic stress, busy lifestyle, too much caffeine, the SAD diet, standard American diet, inflammation, viral bacteria, yeast, mold, heavy metals. Once again, the list goes on. Postpartum depression, pregnancy amplifies this in many cases due to hormone changes. Hypothyroidism symptoms treated with hormones, even when the blood tests are normal, floods bloodstream receptors resistance. So eventually the pituitary stops talking to the thyroid. So this is hypothyroidism secondary to the pituitary hypofunction. We lose the function of the pituitary gland and we don't communicate with the rest of the body. Number 3, this is a thyroid under-conversion model. The thyroid is making enough of the T4 as it comes back down, but a decrease in the conversion from the T4 in the liver and the tissues to the T3 is occurring. And why does that occur? Because of chronic stress. The adrenal glands pump more cortisol, which suppresses the T4. So when the adrenal glands secrete too much cortisol because of stress, then your thyroid can't go through and get the T4 down to T3 conversion. So in this case, free radicals from chronic inflammation damages the cell wall, hampering this conversion. Blood tests are normal for TSH, low for free T3, and total T3, and often missed because T3 doesn't affect the TSH. A conventional medicine, they're not going to give you any other treatment. They may prescribe hormones due to the symptoms. But from a traditional standpoint, we're going to rule out the autoimmunity. We're going to test for the stressors and causes of inflammation. We'll remove the stressors, and we're going to improve the antioxidant levels and decrease free radical mobilization in your body so that we can help get you well. So each of these are the 3 here. We have the 4th is the thyroid overconversion and the decrease in thyroid binding globulin. So remember, too much active T3, the active form, is made, and this overwhelms the cells. It's kind of like having way too many kids on a bus stop and the bus can't get them and pick them up and take them to the destination. Too little thyroid binding globulin, which means too much free T3 because it's not being carried to the cells. And why does this occur? Insulin resistance, blood sugar problems. Polycystic ovarian syndrome causes an increase in testosterone levels in women, resulting in too much of the T4 to be converted to the T3 and too little of the buses or the carriers to deliver to the cell. Blood tests to identify this are going to be your TSH, which will be normal, free T4 and free T3 are going to show up as high on that blood test. Conventional medicine is not going to do anything about it. There's no treatment. They might prescribe the hormones to try to balance out the TSH, but what we're going to see is they're going to give you symptoms. Remember that TSH is normal in this case, so they might just play with hormones for a little while to see if they can help you. Functional medicine, control the blood sugar and reverse the insulin resistance. We have to get to the core causes of the problems. In some cases, liver detoxification is needed, which we do, and we provide you with the answers of how to do that in our office. Thyroid binding globulin. Remember the taxi cab, the little boat that carries free T3 to the cells. We get too many buses carrying or boats carrying the T3, and this occurs. So Oral contraceptives can cause this. Estrogen hormones can cause this, such as Premarin or estrogen creams, cause an increase in the estrogen, which leads to increased thyroid binding globulin to be released and produced. Blood tests is going to show your TSH is going to be normal. Free T3, free T4, and T3 uptake is going to all be low. Medically, we're not going to have any treatment for that. We're going to prescribe hormones to improve the symptoms. Functionally, we're going to rule out the autoimmunity. We need to clear the body of excess estrogens. We're going to provide nutritional support so they can have normal, healthy function again. That way we can get the gallbladder working properly, we can get the liver working properly. It's all in our program. The thyroid resistance, pituitary and thyroid glands are fine, but hormone levels in the blood are good. However, the hormones are not getting into the cell, thus you get a hypothyroid symptoms. And why does this occur? Well, this occurs because of chronic stress. Chronic stress affects the adrenal glands and produces too much cortisol, which causes the cells to be resistant to the thyroid hormone. So these are the 6 patterns of thyroid dysfunction. In this case, with thyroid resistance, I wanted to make sure I include everything. We get elevated homocysteine, which is an inflammatory marker on your blood. You're genetically predisposed to hypothyroidism, and improper monitoring of the hormone replacement therapy can all be causes of this. Your blood tests are going to be normal. Conventional medicine, and we're not going to give you any treatment, but we might prescribe the hormones, and this can improve symptoms temporarily. Remember, sometimes when you get on these hormones, you get a honeymoon period of time where you feel better. But in most every case, you're going to get the symptoms to return again because we haven't gotten to the core cause, root cause of the problem. Functionally, we need to rule out the autoimmunity. We have to get your immune system working properly. It's the only way that we can get you healthy is we have to get that immune system working properly. Regulate the adrenals, regulate the blood sugar, make sure that the liver is working properly. So all of these things together make a big difference. I'm going to review this one more time. Your hypothalamus secretes thyroid-releasing hormone to the pituitary gland, which secretes thyroid-stimulating hormone, down to the thyroid, which releases T4, 94% inactive, T3, 7% active. Thyroid binding globulin then carries that inactive form of T4 into 60% into the liver, 20% to the gut, and 20% to other tissues. Once that conversion takes place where we go from inactive to active, we're going to shuttle that down in, and it's going to be able to get into the receptor cells. This is all the process of how your thyroid works. I don't know if your doctors talk to you about it, but we can have that problem. Remember, we had the first problem, that we had 6 patterns. Got the problem up with the hypothalamus not secreting thyroid-releasing hormone. We have a problem with the pituitary gland. We have a problem with the thyroid gland, not sending that thyroid peroxidase with the iodine to come back down and get conversion of T4, T3 and released. The thyroid binding globulin, we can have a problem with that not carrying it into the cells. And we can have a problem with the conversion itself, either in the liver, the gut, or the peripheral tissues. And last but not least, we can have a problem with the receptor not being active because it's been overfired and overstimulated for such a long time that it doesn't listen to the nervous system anymore. So remember, we have to have a good thyroid in order to have normal functions of your metabolism of all your cells in your body. The key to good thyroid health is getting enough of that T3 into the cell so it can work properly. Now, thyroid dysfunction is a sign of metabolic dysfunction. I think I've kind of talked about this throughout this video. And super important that as we go through, we have to have proper testing to find out what's the cause of the problem. Our complete testing includes a complete metabolic profile, complete thyroid panel. It's an expanded thyroid panel, vitamin D levels, anemia. We want to check and see if you are anemic, how the red blood cells and your breakdown of blood cells are, kidney function, blood sugar levels, your cerebellar antibodies, your female hormone panel or male hormone panel, your immune panels. We need to check and see if there's an imbalance between Th1 and Th2. It's kind of like a teeter-totter. If you have an imbalance of your Th1, Th2 of your immune system, you're not going to get well. We have to evaluate that for the cytokines. We're going to check that on your blood test from the CD4, CD8 ratios and your natural killer cells. We're going to run an adrenal stress index. It's a salivary test. We have it here in the office. You can come by, you can pick one of those up when you start care, and you'll take it home, and it's a salivary test, so you'll be doing that at home. It'll check your 24-hour cortisol levels. Food sensitivity testing, we're going to do this from a stool test. We'll find out if you have any antigens from gluten, from soy, from yeast, from milk, from eggs. We're going to also check some other foods. There's some cross-reactive foods that we want to check. We'll do a stool microbial ecology profile. This will check you for gut infections, parasites, yeast, mold, bacteria, virus, and heavy metals. Vital that you get the proper testing. Do you see why your doctor hasn't got you well up to this point? I hope this has made sense to you. Now, what makes our office different as far as with our care is we're not going to leave any stone unturned. That's me sometimes as I go through with these cases and help people. It's like pushing a boulder uphill because you haven't been educated in a way from a functional standpoint with your health to get to the root cause of the problems of what's giving you ill health. So what I want you to understand is that we will leave no stone unturned to determine the exact cause of why you're suffering with your condition. We're going to provide you with neurological therapy. This is brain-based therapy. Now, remember, the brain fires down to the hypothalamus, which then fires down to the pituitary, which then fires down to the thyroid. So it's a brain-based problem. We're going to do a comprehensive neurological workup with you. I'll spend approximately 30, 40 minutes with you doing this neurological evaluation that you probably have never ever had in your entire life. We're going to check things your doctor hasn't even thought about looking at. Otherwise, he would have done it already. Everything I've talked about, if your doctor knew better, he would have done the things I've just reviewed with you. We're going to do this neurological workup because the brain fires to that hypothalamus, which fires to the pituitary gland, which then fires to the thyroid. Now, we have to determine what's going on with you because the frequency of firing. Every cell in your body has a frequency of firing. It fires and fires and fires and fires. And if we lose that frequency of firing from left side to the right side, that can impact how you feel, can impact how your brain is functioning. So we have to have cross-talk, we have to have that communication in each direction of the brain. Left and right, right and left. Neurologically, we need to check your cerebellum, which controls your accuracy, your balance, and your coordination. Cerebellum in the brain requires two things in order to function properly. Two things to survive, to give you good, optimal health. Now, my grandfather lived to be 101, and a lot of people are living to be over 100 years old with quality of life, and that's the key. I don't want you going through this merry-go-round, reaching your 60s, 70s, 80s, and seeing your health decline. From this day on, this is in your control. We need fuel, which is oxygen and glucose. Glucose from the foods that you eat, oxygen from the air that you breathe, and we need activation. So we provide not the general chiropractic adjustments, but we do what we call unilateral adjustments, unilateral activation of your nervous system. We also use other modalities in order to get that activation to occur. But we'll provide you stimulation from one side of the body or the other, one side of the brain or the other. And this is brain-based rehabilitation. So if you look up on the internet or anything, you look at brain-based therapy, you're going to see a lot of different sites that can describe that. Brain-based therapy helps to balance the frequency of firing. Remember, left and right, right and left, everything has to continue to be stimulated. The primary function of the brain is inhibition, to decrease the stimulation. But if the stimulation is not there to be decreased or to be inhibited, it's going to cause what we call wind-up. It's going to cause problems where certain areas of your brain continue to fire over and over and over trying to get that stimulation. So we have to have proper communication, left and right, right and left, top to bottom, front and back. Everything's got to work properly in your brain for your thyroid to work properly. So how are we going to help your thyroid condition? We're going to find through lab tests the antigens and the causes of your dysregulation. We're going to remove the causes of the dysregulation through specific dietary changes. We're going to repair your damaged tissue with specific nutritional supplements. And I use product through Premier Research Labs. It's one of the only companies that are excipient free, meaning they have no binders, no fillers, no additives, no synthetic additives in order to bind them into a capsule or into a tablet form. But these excipients are causing problems with the supplementation that you're taking. We've all seen on the news that supplementation isn't good in one way or another. It's because they're using cheap product, and they're using excipients with tar and coal and other binders in there that are causing havoc in your nervous system. So you have to get quality nutrients. Balance your immune system with specific nutrients and vitamins. And we're going to find through neurological tests imbalances in that frequency of firing of your nervous system. This will in turn improve your brain function with oxygen and brain-based therapies. So as we go through, there is light at the end of the tunnel. We need to make sure that we have provided you today with some hope, because it's all in the evaluation of what your doctor has been doing with you. Have you been mismanaged? Do you still suffer? You've continued to have these same problems over and over? If it's hormonally, if it's brain fog, if it's hot and cold flashes, if it's losing your hair, if it's weight gain, all of these symptoms come back to thyroid dysfunction. So 5 key questions I want you to ask yourself. On a scale from 0 through 10, how would you rate your desire to get well? In our office, we only accept those patients that are from a 9 to a 10. You have to be motivated. You have to be ready to make some lifestyle changes in order to get well. That's the key. You have to be ready to take the steps to get well. If you're not ready to get, if you're not sick enough, you're not ready enough. But believe me, in time, you're going to get tired of going through this merry-go-round. You're going to say, okay, I want to get to the core cause of the problem. Next question is, how have your thyroid symptoms affected your job, your relationship, your family, your ability to go do the things in life that you love to do, play sports? What does it cost you in terms of time, money, happiness? Are you sleeping through the night? All these things are about quality of life. And that's what I'm all about, is I want to make sure that we provide you with quality of life. Where do you picture yourself in the next 1 to 3 years if your thyroid problems are not managed properly? Have you been going through this for a number of years already, or is this a new diagnosis? Well, how do you picture yourself in 1 to 3 years if you don't correct the underlying causes of your problems? So these are the things that are going to happen with your evaluation in my office. We have 2 visits that we're going to provide for you. Visit 1, we're going to do a complete thyroid examination and neurological evaluation for you. We're going to review existing lab work, so you need to bring that in. Make sure we order it. We'll get it copies from your doctor. You go pick up the copies from your doctor, bring them in with you. We want to review those with you. If you have 2 years, bring 2 years. We'll put them in our software program, and we'll show you how you've actually been managed and if anything's actually changed over that period of time from a functional basis. Review of metabolic assessment and neurotransmitter assessment forms, which we will provide with our intake paperwork. And so it's a good idea to have your spouse or significant other present as well. Now, on your second visit, we're going to review the exam and neurological findings with you from the first visit. We did your exam, got your paperwork. We're going to sit down, we're going to review those with you. And if we accept you for care in our office, if you're a candidate and we honestly feel that we can help you, we're going to go through and we're going to provide you with an overview of further complete testing that needs to be done. We're going to provide you with a review of financial obligations to participate in our thyroid recovery program. And once again, the spouse or significant other must be there. We do ask that you wear t-shirt and shorts when you come in for the examination, or bring them with you if it's too cold outside. And it's very, very important that we have you confirmed for your appointment prior to your arrival. And we have those records in our office prior. So our special offer that we provide with you, what I'm going to provide for you for your examination and your consultation review, our normal fee is $250. What we're going to do is we provide this for $60. Hey, I want no reason for you not to get the help that you need. And what more can I do than to give you an hour of my time and provide you with the answers that you've probably been looking for a number of years. So to allow us to help you resolve your thyroid problems, you can contact our office at 714-730-5833. It's been my pleasure to help you to educate yourself and hopefully expand your mind a little bit about what's going on with your health. My name is Dr. Michael Corey. I'm here at Wellness Stop Chronic Healthcare Center in Tustin, and we're at your service. If you have any questions, feel free to give the office a call, and I look forward to doing your evaluation and getting you back to your optimal health. Thank you.
Hi, my name is Tresson, and I've been seeing Dr. Corey for about 1.5 years. I was tired all the time. I had thyroid issues, arthritis, chronic pain, and all my blood tests have been shown vast improvement in those areas, and I'm feeling lots better. I've appreciated his generosity, his giving spirit, and his positive attitude, and I would just recommend him to anybody that wants to get better.
Hi, I'm Maria, and well, I come to see Dr. Corey, and it was a godsend that I did because I was struggling with a lot of pain, and previously, just seeing my primary care physicians, and it just got referred to a lot of different specialists who I just felt, I just weren't taking the time to really treat me. I just won't name names, but I did have maybe one person one day referred to another person the next day, and it was either pills or they would say maybe surgery. And I just really felt I wasn't being heard, and I did try some of the pills that were recommended, and I just felt they made me feel worse, and my pain was just becoming worse, and I couldn't think well, and so I went online, and thank God I felt like I was directed to Dr. Corey because I was very desperate at that point. I really was, and I couldn't take the pain, and I had pain in several places, which they called symptoms of fibromyalgia, and a lot of the times I did feel like people weren't taking me seriously because the pain would be in different places and just in many places, and it was all new to me too. So I was glad to, when I came here to Dr. Corey's office, that he listened to everything, and he asked me to list all the different things that were bothering me or where I felt pain, and just for him to be able to tackle the list. So to me, first of all, it was amazing that someone would take the time to listen and to try to tackle more than one thing at once. So I felt that he was really listening to me, and that he was, taking me seriously in my pain. And I mean, I had shoulder pain, I had pain in my hands, pain in my feet, back pain, a lot of back pain, foggy memory. I felt like I couldn't think, make decisions. I really, at times, felt like a vegetable with a lot of anxiety at the same time. It was just a very weird existence at one point. And so I really felt like I made the right decision and come here because Dr. Corey didn't give me all these meds that were prescribed to me. He did make some, what I liked is that he treated me holistically, and that he offered dietary changes, exercises, stretches. Because I also had pain a lot in my chest. A lot of my ribs seemed to pop out of place, and that was excruciating pain. And he gave me exercises that I could do, which I thought what's the word? I couldn't believe that one day I could move with the kind of movements that he was recommending, and now I can, and I sit comfortably, and I feel comfortable, and I think I've gotten beyond the point of the pain there. But anyway, there were times I would wake up with tight fists like this, and my body was constantly tense, so and I'd wake up with a lot of nausea, and it felt like I couldn't even eat. It was a big mess. So it's been a few months, and I am thankful that in the short amount of time that I have seen Dr. Corey, there have been great improvements. I gave my other doctors definitely about 1 year, and I just felt I was getting worse and worse, and to the point where I was thinking, wow, can I even go to work? And so the time that I've been here, a few months, I would say about a half year, I felt like I've improved a lot, and I'm just very thankful to the staff who've been really kind, and Dr. Corey, who's just also been just a great listening ear, and just someone with a wonderful bedside manner who is there for you. And is there to help you in any way. Let's see. So if you have similar symptoms, I just really highly recommend Dr. Corey. He's done a lot for me, and I just hope that you can find your way here and also experience the difference. Thanks.